So in terms of the plan for this evening, I am doing my usual, if you've been to these before, brief kind of run through about some of the things that are happening at the hospital, picking out some of the things that have been going on recently and our plans for the next few months and year ahead. And then I will hand over to colleagues to talk about the innovation and sustainability projects. There'll be a Q&A session at the end of my bit, and I have a lot of colleagues on the call. So if anything I say triggers a question, it may be something I can answer, or I may hand to a colleague to pick that up. But that's about the more general kind of what's going on at the hospital elements. So there'll be a Q&A session then, and then there'll be another Q&A session at the end of all of our other presenters. So you can ask any questions about the sustainability projects, the amazing work that's been going on with our various teams. So that's the plan. I think I can see Jan on my screen, but not Gemma. Just nod. Have I said everything I need to say in terms of housekeeping? Yeah, good. All right. So let me go into our trust update then. And let you know what's been going on. And we've got some slides to share that I think Gemma's going to share. Or have we lost Gemma? The whole thing may fall over if we lose Gemma. Aha. Excellent, thank you. So this Health Focus event is particularly about innovation and sustainability. If we go on to the first slide, trust update, and the next slide is just a reminder of who we are at Hampshire Hospitals. I always like to start with the people we serve, and we provide care to a population of around 600,000 people who live across Hampshire and parts of West Berkshire. We do have some patients coming from much further afield as well, but the vast majority of our services are for our local population. And we deliver high quality joined up care to that population. We've got around 30 medical and surgical specialties. We have over 8,500 brilliant colleagues, our staff members. And the way we're governed is through membership, and many of you will be here this evening because you are members, and the members elect governors, and I've seen some of our governors already on this call. Thank you for joining us. We have public governors and staff governors and stakeholder governors, and they help to direct our strategy and our direction of travel, and to make sure we keep remembering and listening to the people we serve, our population, and around 7,000 public members. You see the photos here of our 3 hospitals, Basingstoke, Winchester and Andover. And also tonight, we're going to be talking about the new hospital programme a bit, which is a once in a generation opportunity to invest in hospital services with up to £900 million of capital coming our way over the next decade. It's not all arriving imminently. So that's who we are. And the other important bit about who we are is our values. And in the last couple of years, we have updated our values. We've had our care values for a long time about compassionate, accountable, respectful and encouraging. And we added inclusive to the front of those, partly in recognition of the changing dynamics of our population and of our workforce, our colleagues, but really reflecting the fact that we are and always have aimed to be a very inclusive organisation. And it felt we wanted to make that really explicit in our values. So this is how we aim to work each and every day. We might not always get it right, but this is where we're aspiring to be. Our vision has been the same for a number of years, to provide outstanding care for every patient. And we've had these 5 strategic themes for the last couple of years. And in my slides that I'm going to tell you what's going on, I'm just going to pick out these themes. So the first is about outstanding care for every patient, then about making our trust a great place to work for our people, then working together for our population, making the best use of our resources, and finally innovating for a sustainable future, which is the theme of the rest of our presenters this evening. So each year we look at these 5 and we say, what do we want to achieve? And so I'm going to tell you a bit about what we've achieved in the year that's just finished. Our year always finishes at the end of March. And then a little bit about what we're aiming to do in the year 24-25 that we've just started. So under outstanding care for every patient, here are a few of the highlights from what's been going on. So one of the things the CQC does every year is it surveys patients that are going to all the hospitals across the country. And one of the things we felt really proud of in the last year is that the survey they did for emergency care, that's people coming into our emergency departments, Hampshire Hospitals received the highest ranking in the southeast of England for the overall patient experience. Now, before I get a whole outcry, we are not providing the experience we would want to provide for every patient. We still have long waits in our emergency departments, and we are working really hard to improve that. But what I think our teams in the front door of the hospital have been focusing on is, if patients are waiting longer, how do we make sure they know why they're waiting? They know what the next step is. They've got food and drink and blankets and pillows and whatever else is needed. It isn't what we'd want it to be. We don't get it right for everyone, but it was really lovely to hear that the patient feedback was overall positive despite the challenges that we are tackling. In terms of our staff survey results and caring for our patients around compassion and inclusivity, so that is really important to us, and it's good that that was one of the highest themes that we got, and that compassion and inclusivity for our staff, but also for our patients. In terms of maternity services, 97% of people who use maternity said that they would recommend that, strongly recommend, and in terms of our friends and family, and it was a positive experience of care. In terms of bringing down long waits for our patients waiting for surgery, we had a goal that no one should have been waiting more than 78 weeks by the end of March. We did actually hit it in April, but in March we had 7 patients, I think it was. None of them were waiting because we couldn't fit them in. They were waiting because they chose to have their surgery later on in the year, or because they had a very complex pathway with a neighbouring trust. So we got to single figures. We're now trying to tackle the 65-week waiting and then the 52-week. It is unbelievable that we're talking about people waiting a year for things that will improve their lives, but we are bringing those waits down. And we opened our new heart centre. It has been open for about a year and had seen 2,700 patients on the day we opened it, but we had a formal opening of the new heart centre in Basingstoke, which is a brilliant piece of estate and is really making a difference to cardiac patients for across a whole wide geography. In terms of the next slide's about our staff. We skipped a slide. That was about our staff. We seem to have jumped over the staff one. So resources, that's it. Our people, making it a great place to work for our people and working together for our population. So under these 2 strategic themes, some of the highlights. Well, I'm first going to call out Rob, because you can actually see him in real life moving on one of your screens. So Rob was awarded the Hospital Caterer of the Year at the Hospital Caterers Association conference. And you're going to hear from him. He runs all of our catering services. We get really positive feedback about the food for patients and for staff. But one of the things I particularly love about Rob is if anybody is unhappy with the food, he'll run up to a ward, have a conversation with them, say, how can we make it better? Really keen to respond to what we need in terms of our patients, and really recognising the benefit of good nutrition in patient care. But you're going to hear from him later about an amazing project they did to reduce food wastage as well, which is good. Oh, and Gillian said the mushroom ravioli was amazing this week. Excellent, Gillian. Yes, we get great feedback. You'll also see a photo here of some of nurses from Nepal who joined us. We've been part of a national scheme with the Nepalese government and the British government to provide a safe route for qualified nurses from Nepal to come and work in the UK, because for a number of years there have been I would always say criminal networks kind of bringing Nepalese nurses over with all sorts of promises about jobs and visas that they then don't fulfill. And so the Nepalese government and the UK government wanted to provide a safe and supported route. And they picked Hampshire Hospitals because we have worked really hard to make sure that colleagues joining us from all over the world do feel supported when they arrive. Not only supported in their workplace, but that we, help them to settle in Hampshire and feel welcome as part of our communities. So we're really grateful for the nurses from Nepal that have come and joined us. In terms of working together for our population, you will see here a thing called SWASH and SECTRA, or slight jargon, but this is about if you have your radiology scan, so a CT scan or an X-ray or a MRI scan, anywhere in Hampshire Hospitals, Salisbury, Southampton, Portsmouth, the Isle of Wight, or in one of the Southern Health Lymington, for example, facilities, that image can now be used in any one of those other places all over again. So we particularly do a lot of work with Southampton. We have a lot of feedback that someone might come for a scan in Winchester or Basingstoke. They then need a tertiary level of care, the expertise that can only be provided in Southampton, and that image isn't available. Well, now it is. And I know many of our patients will imagine that had always been the case, but it hasn't. And it is brilliant now that we have managed to do that. It was not an easy project, but it was carried out really well. And it is making a massive difference to patients and to clinicians. We also had our public consultation on the Hampshire Together programme, and you're going to hear a little bit more about some of the steps around that a bit later on. A massive piece of work. We talked to thousands of people across Hampshire, asked them what they thought of our ideas, got lots of incredibly rich feedback, and we will be sharing more about that later on in the year. And then you also, going back to our people again, you see that our Hampshire People Awards, Hampshire Hospitals People Awards, we've announced 45 finalists. We had over 500 nominations, and we have a ceremony in June, in the next few weeks, about that. All this week in our hospitals, there have been tea parties for the nominees, which have been a brilliant way of celebrating our colleagues. And then our last two strategic themes are about using our resources well and wisely, and about innovating for a sustainable future. And in terms of our using our resources, I'm going to just pick the middle one out there. You will see the picture of Winchester Hospital. Earlier today, we had a sod cutting event where we officially launched the building of our new orthopaedic outpatient facility and elective hub. And that will be not only a much better facility for patients, increasing capacity for hip and knee operations and other really important operations, but it also allows us to be much more productive. And what do I mean by that? I think a lot of people think productivity is about, people need to work harder. It absolutely isn't. It is about making sure that the doctors, nurses, therapists, pharmacists, the clinicians who provide care are able to provide care for as many patients as possible in a really streamlined way, and that we set up our buildings and our processes so that more patients can be seen, treated, cared for, and get back to the lives they want to live as quickly as possible. And these facilities will be designed to help with that productivity, making it a lot easier for our clinicians to provide the care they'd want to provide for our patients. In terms of innovating for the future, you're going to hear about these green team competitions. We ran this green team competition funded by our charity, and thank you to anyone that donates to our Hampshire Hospitals charity. And we had a number of teams make a massive difference to their particular service, generate savings towards net zero, so reducing our carbon footprint, but also improve clinical outcomes and reduce costs. We've won a national award for our rapid point of care testing, reducing unnecessary hospital admissions, and working with SCAS, that's the ambulance service, and Southern Health, our collaborative initiatives have really been recognised nationally. And then the last little box at the top there is just to say that our 24-25 plans, we developed them with our staff, our colleagues, our patients and our governors, and that's now live, and you can see a bit more about that on our website, but I'm going to share some real highlights, I think, on the next slide. So our priority areas for 24-25, there is a lot of work we're doing in the year ahead, and I'm not going to read out all of these, but just to say that under our 5 themes about outstanding care for patients, great place to work for our colleagues, working together for our population, making best use of resources, and innovating for a sustainable future, we've got key programmes of work that will help us deliver across all of those areas. And the thing I want to, I'm happy to answer questions on any of these or any other areas, but one of the things we've been working at more and more over the last few years has been in this middle column here about improving the health of the people and communities we serve and reducing health inequalities. So moving us from a hospital service that fixes people when they're broke, we still need to do that, but to also see our responsibility to help people live healthy lives and support with inequalities in health outcomes as part of the health and care system. And so that is a focus for us. It has been for a couple of years, and it will continue to be in the years ahead. So I think that's a whistle-stop tour through some of the things that have been going on and some of our plans for next year. I'm happy to answer any questions on any of that at this stage, or my executive colleagues may wish to come in as well, or any other colleagues, and talk about any of those things. I'm not sure if we've had anything through Q&A, or I think chat is Gillian singing the praises of mushroom ravioli. Is there anything else that's come through, or does anybody want to ask, or are you just desperate to hear from our colleagues? Should we move on, Jan, and hear from the colleagues? Oh, we've got a question here. Okay, or a sincere congratulations. Oh, thank you so much. Yes, well, we're trying to head towards innovative and sustainable heights. And yeah, you're about to hear some more about some of that. Thank you so much. Okay, let's move on. And if you do have questions, we can always come back to them at the end. Feel free to put them in the chat or the Q&A. Okay. All right, so I think I'm going to introduce now Charlene. So Charlene O is our Chief Strategy and Population Health Officer. She's also our Senior Responsible Officer, SRO, for the New Hospital Programme. And she is our exec champion around sustainability in terms of environmental, net carbon zero and that side of things. And she's accompanied by Gillian Brown, who is our sustainability manager, lead, kind of enthusiast and person who, honestly, I sometimes say I think Gillian must be a triplet, because she gets so much done, and she everybody knows her, and we are very lucky to have her. So I'm handing over to Charlene and Gillian. Over to you two.
Thank you, Alex. And I just want to say this is being presented on behalf of lots and lots and lots of people who have done amazing work. You will hear from some of them, but there are a lot more you won't hear from. And it's really their energy that has taken us to where we've got to today. So I'm going to start in another part of the world. So you may have seen in some of the programs on TV about the sea around the Solomon Islands rising 3 times faster than average due to global warming. Now, the change may not be as obvious in the UK. However, and I wasn't aware of this, in the heat wave of 2022, the excess deaths that we had due to that hotter summer was just under 3,000. And the number of deaths attributed to poor air quality due to air pollution in the UK was somewhere between 26,000 and 38,000. So it is impacting us, and therefore, by being a health organization, we needed to make sure that we were contributing positively to people's health. So for the next slide, we recognize that as an organization, as Alex says, of over 8,600 people and serving a 600,000 community, we have a major role to play and a major impact on health. So there will be some points later about, you know, how we all make a difference and what we can do to make the difference. But I wanted to highlight that it is recognized that it is a discipline, and planetary health recognizes that the climate emergency is a health emergency. The Lancet has published a journal on planetary health that recognizes it. It crosses health and the physical and natural sciences. And some of the questions there that they're trying to answer in their research, I thought was really interesting, including, for example, which mineral deficiency in humans is related to carbon emissions. We will be going through a quiz in a couple of minutes. So just stay with me whilst I just run through the next slide very quickly about health and our carbon footprint. So it is actually paradoxical that a substantial contributor to the human-induced climate change is actually the healthcare sector itself. So globally, healthcare contributes to 4%. What does that mean? That's the equivalent of 514 coal-fired power stations. And if we were a country, healthcare would be the 5th largest emitter on the planet. It's no different in England. We make up about 4% as a healthcare sector, and the breakdown there is provided in that pie chart that you see. The ambition is that we, the NHS, will be net zero by 2040, and we have an ambition to reach an 80% reduction by 2032. So instead of me giving you lots more figures, we thought it'd be really much more fun for you to participate in a quiz. So if you can access your chat, and we will be asking some questions, and then we will provide some answers. So if you're ready with your chat, first question: how will the climate crisis affect health? A, it doesn't impact public health, only affects temperature and weather events like storms. B, it'll impact individuals hurt in extreme weather events. C, it'll impact only areas with weak health infrastructure like developing countries. And D is the single biggest health threat. Answers in the chat, please. Okay, right. Brilliant. Don't think we need to it gets slightly harder. Okay, next question, please. So between 2030 and 50, climate change is expected to cause how many additional deaths? Answers in the chat as well. Fantastic. I don't think we need this quiz, do we? Okay, right. The answer is D. Question 3. Which of these has a bigger carbon footprint? Healthcare services in Spain, NHS services in England, the entire country of Bhutan, all of the planes departing from Heathrow Airport. Have you done this before? Okay, it is actually B. Fourth question. The NHS is responsible for what percentage of UK public sector emissions? I know I gave you the 4% figure before. That is for healthcare compared to everything else. Oh, a bigger range of responses here. The answer to question 4 is D, half of the public sector emissions, which is quite substantial. Question 5, how much waste do NHS providers produce each year? Some variation. I think most people are going for D. It is D, 156,000 tons. So I think, most people seem to have been, aware of most of the responses to this set of questions. So we would now like to tell you more about the Green Plan, and also have some of the presenters talk to you about their specific projects. So I'm going to hand over to Gillian to do that.
Thanks, Charlene. Hi, everybody. So I'd just like to kick off by saying the Green Plan. Every trust in England has a Green Plan, and this has been mandated since April 2022. So Hampshire Hospitals Green Plan specifically sets out how we will support the national agenda by reducing our own environmental impact. And actually, it's across every aspect of trust activity. It's a big job, I won't lie. We are responsible for well over 60,000 tonnes of carbon dioxide every year. But we do have our Green Plan set out with 10 chapters, and all of those chapters have actions that will help us to reduce our emissions. And we've been really busy over the last couple of years implementing lots and lots of projects across the organisation. You'll hear more in a few minutes just about how we've been working hard in 3 of the highlighted areas in green there. So this next slide shows really where our emissions come from and how they're categorised. In the NHS, we use the international standard called the Greenhouse Gas Protocol, and this divides emissions into scope 1, 2 and 3. So NHS England has set this 2040 net zero target, which targets emissions from activity in the white boxed area. So this is called the NHS carbon footprint, and it really relates to emissions that are mostly within our control. So things like electricity and gas use, anaesthetic gases, things like emissions from our vehicles. And we also have a 2045 target, and that relates mostly to scope 3, so the kind of middle blue area in the middle of the illustration. This covers everything that we purchase, so things from medicines to computers to food, and it accounts for approximately 60% of our overall carbon emissions. So a really big chunk. And actually, it's the hardest for us to reduce, where we really can only influence our suppliers. So these targets, they are really ambitious, and they really require the action from everybody, from staff, from patients, from visitors. We really need everybody's help to help achieve these. And it could be something like a virtual appointment rather than a face-to-face appointment. It could be making sure that our new buildings are built to net zero standards. It could be making sure that our staff are aware of how they can commute to work in a more active and sustainable way. I think just to kind of say that it really is all about having everybody has a part to play, and all the little actions really do add up. So those are the slightly scary carbon reduction targets, I'll be honest, that we have in our Green Plan, but actually we aim to deliver more than just carbon reduction. The overall objective is to support a shift towards sustainable healthcare, and that means improving our day-to-day practices to deliver healthcare that provides the best outcome for our patients without negatively affecting the planet, people, or pounds in the bank. So we started this shift towards a sustainable healthcare approach by trying to measure the environmental, social and financial impacts of our activities, sometimes known as the triple bottom line. So using this approach allows us to assess and make decisions based on the bigger picture, and which will hopefully help to create a greater awareness of the impact of our decisions. Next slide, please, Gemma. So creating awareness and engaging with our staff, it's really, really important, and it's been a key priority over the last year, really to embed this culture of sustainability across the organisation. We've talked a lot to staff. We've participated in events. We've held bike doctor surgeries to give free bike services to staff. But the really key project has been the implementation of the Green Team competition, which is run by the Centre for Sustainable Healthcare. So the project really aims to engage teams in their own departments to run a sustainable healthcare project over 10 weeks. And throughout that process, we measure the triple bottom line. So we get some really great data from that. In fact, it was so successful that we've been delivering all the positive outcomes. We've just kicked off Green Team 2, and we've got 6 brand new teams. So I'm really excited about reliving that experience again. So on that note, I'm really delighted to say that we've got 3 case studies to present now from a Green Team competition last year. And I think first up is Laura and Krithia from our Winchester Hospital, who I think are actually working today and in their scrubs. and they're going to talk about how they demonstrated and looked at reducing waste in the operating theatre. So over to you, ladies.
Thank you, Gillian. Thank you. Thank you for having us tonight. We are going to talk today about reducing waste in the operating theatres. Specifically, we're going to talk about the project that we, QI project that we did under the Green Team competition. We wanted to start firstly, my name's Krithia. I'm a recovery nurse practitioner.
And I'm Laura. I'm one of the anaesthetic practitioners at Winchester.
We're going to start by just showing a short video which really highlights the amount of waste that is produced during an operation. If we can get that to work.
Yeah, so every time I see that video, it's still sort of just as impactful as the first time. As you can see, operating theatres are hugely resource intensive, and the carbon footprint of surgical care in the UK in 2019 was estimated at 5.7 million tonnes of CO2. And it's really this abundance of single-use items that motivated Krithia and I to sort of become link practitioners in our department and sort of champion the sustainability initiatives. So also along with that, working in healthcare, that link between climate change and health is really important. So over the last sort of 5 years, we've developed networks in our department, and we now have sort of quite a wide range of clinicians and different practitioners from different backgrounds, and that's really important for getting projects off the ground from people that are experts in that area. And what we've wanted to do is try and take as much opportunity as we can, and the Green Team competition was an amazing opportunity for us to sort of drive some of these projects forward.
Sorry, Gemma, can we just go back one slide? Oh, sorry, it's different in our idea. Okay, so I was just going to talk about the aim for our Green Team competition. So the aim was to oh, there we go. Thank you. Our aim was to identify where we could implement a circular economy to improve the sustainable value, considering the triple bottom line, which Gillian's already talked about. So this is what we decided to base our Green Team competition on. So yeah, next slide, please. Yep. So these are our this is what we did our Green Team competition on. We chose 2 specific things to look at. I'm going to talk about the harmonic scalpel, and then Laura will talk about the reusable gowns. So firstly, the harmonic scalpel is, if for anybody that doesn't know, it's used in laparoscopic surgery for cutting and cauterizing tissue. It's quite a large instrument, which was previously disposable. So after every operation, this piece of equipment was just thrown away. we found out that there was a service used to remanufacture these harmonic scalpels. So there's a company that once it's used, they then take it away, strip it down, clean it, sterilize it, replace any broken parts, put it back together, and it's certified to be compliant with EU regulations as if it was a new product. And then we buy it back from that remanufacturing company. So this whole process can be done twice. And we are already selling the product to this company, so it was quite an easy process to try and just buy them back. They were also half the price than buying them brand new when we bought them back from that manufacturing company. To make this work, there obviously still needs to be a certain amount of new products into the supply chain, and so we are purchasing these back now at a ratio of 67 to 33. As you can see on the slide, it gave us a really good carbon saving of 365 kilograms of CO2 equivalent, fantastic financial saving with no difference to patient care. We had good feedback from the clinicians, as effectively they're still using the same product. There was no change in the way that the device worked. So it's an excellent outcome.
Okay, so I'll just talk a little bit about the reusable surgical gowns. So self-explanatory at the moment, all our gowns are single use and they're thrown away after use. But there is an option for reusable textile gowns, and this is what we're hoping to move to in the near future. So this sort of process of the project was similar to the harmonic scalpels. For every project, we need to make sure that we engage all the stakeholders at every level. So everyone that's going to use them, everyone that might be involved in the ordering, anyone that might have a vested interest in their use. And this is really what takes the time, kind of just studying the system, as it were. As you can see, it's completely worth doing. The carbon savings are huge. So over 52,000 kilograms of CO2 per year. And the financial savings are also really quite significant. In terms of sort of patient and social outcomes, we don't see any detriment to patient care. Similar to the harmonic scalpels, so they comply with the regulatory standards the same as the disposable gowns. And when we trialed these and audited, 98.6% of staff that trialed them found the reusable gowns to be clinically acceptable. So yeah, this has been a long sort of ongoing process, and we hope to have these implemented in the next couple of months. Yeah, that's our project. So looking forward to sort of future projects within theatres at Hampshire Hospitals. We're really excited to have been accepted onto the Green Team competition again, and we've got lots of probably very ambitious ideas, but these are just a few things that we're working on. So one of them is switching from intraoperative IV paracetamol administration to preoperative oral paracetamol. So just quickly, I think the carbon savings are a 12-fold reduction for the oral, and the cost, I think a gram of oral paracetamol is 4p compared to £1.80 something for the IV equivalent. So that's one of them, and we're also looking at switching how we warm our patients during operations. At the moment, there's sort of a bulky plastic single-use consumable, so we're looking into alternatives for that.
Yeah, we're looking at an alternative to a pulse lavage, which is a piece of equipment used in orthopedic surgery, and it's a very large piece of equipment with some batteries that's disposed of after every operation. So we're looking to reduce the waste in that. We're also looking at our energy usage, and we really want to try and reduce the amount of electricity unnecessarily left on equipment, and try and get that all ticked off and shut down at the end of the day. Yeah, so that's what we've got to work on over the next few months.
And I think that might be all of ours. So thanks very much for having us.
Thanks so much, ladies. I know how hard you worked, and I know it was above and beyond the day job, and I know for a fact that you've got a list the length of your arms on projects and ideas and thoughts and suggestions, and I know that when we meet we always have to, you know, ramp it down. So well done to you both, and it's great to have you back in the green team too as well. Thank you for that. So next up is a video from our pharmacy team. So they made fantastic progress in reducing medicine waste, and were just really fantastic to work with. So I think Gemma is going to get this video on the go.
Medicine waste is a huge problem within the NHS, with an estimated 300 million wasted annually on unused or partially used medicines. In hospitals, this waste is added to when patients do not take their medicines home, or when medicines are not transferred with them as they change wards. Our project aimed at changing that by moving patients' medication with them and returning unused medication in a timely manner so it can be reused instead of disposed of.
So before our project begins, the medication is dispensed here in our pharmacy. A clinical assessment of every prescription is undertaken by a pharmacist to determine the suitability of the medication, the appropriateness of the quantity, and the dose frequency for the patient. When the prescription is selected by the dispenser, it is then taken into our labelling workstations. This is where they will work through the prescription, booking out the medications to the right ward and patient, and labelling the medicines as per the prescriptions. As the dispensers and SATOs label the medication, the robot selects the medication from the shelves inside and sends them down the chute to the relevant workstation. Once the prescription has been labelled, it then requires dispensing. The dispenser and SATOs then work through the prescription, making sure the medication and label match what the prescription has asked for. It then requires a last check of accuracy. Once the ACPT has completed their checks, it is bagged and put into the relevant trays for the wards. The porters then take the medication up to the wards at set times throughout the day. Any urgent medications can be collected from pharmacy by the wards.
Before the project, there was no clear designation of responsibility across stores, ward teams and dispensaries, resulting in a large volume of medication waiting in the returns area. For this project, colleagues are allocated wards to check at least 2 or 3 times a week for medicines that have been left behind or are no longer needed. Before we return the medicines we've collected into pharmacy stock, we perform rigid checks to ensure that it has originated from HHFT and is stored correctly and is still in its original container with at least 3 months to go before its expiry.
After 1 month, nearly £7,000 of medicines were returned for redispensing, saving over 2,000 kilograms of CO2. If we were to roll this out across 45 wards at the Trust, and we only make half the level of savings, we could still achieve the annual efficiency of £230,000 and 7.6 tonnes of CO2. Not only does this project have those amazing benefits, but it's meant our staff have greater responsibility, we've achieved better relationships with ward teams and improved communication across the board. We did all of this thanks to Hampshire Hospitals participating with the Centre for Sustainable Healthcare in the Green Team competition to explore the impact that pharmacy can have on supporting the green agenda.
It was a great project, and in fact I'm still working with the pharmacy team to roll out and look at how we can escalate and increase that project across the organisation. So really well done to those guys. And last but not least, and in fact were the winners of our competition last year, is Rob Strachan. So he is our head of catering, whose project won us all over by reducing food waste. So over to you, Rob.
Good evening, everybody, and thanks for asking me to come along this evening. So, where do we start? So, we're talking about here about 3 projects within one, really, and with the goal was to reduce the food waste within HHFT. Obviously, we started by starting, we had to look at how much food we were wasting. So we targeted 4 key areas: the amount of food we were cooking over the top, so the production waste, the amount of waste that we were incurring by preparing the food, so our preparation waste, the amount of meals that go up to the wards and coming back untouched, and then the amount of like plate waste where patients were starting meals and not finishing them. So we went on a rigorous program of measuring all the waste that came back and then getting this data, presenting it to the staff, and then coming up with how we were going to reduce it. Okay, so it was quite challenging, but we managed to reduce our production preparation waste by over 15%. But it's not something we can't take off the ball. We've got to keep going, always checking that waste. We're still measuring it now, and then also working closely with these wards about the untouched meals and the plate waste. That leads me on to the next section. So back in last year in September, we had to look at changing the menu and looking at how we would reduce the waste. We were using a lot of items were coming back to when we were recording the waste, there was a lot of items were coming back untouched, which was completely unnecessary. So we used to serve about 1,000 cartons of orange juice a day in little plastic containers. We switched that, we took them off the menu. We kept them on the menu, we took the plastic cups off. So the orange juice is then served at ward level in reusable tumblers. That saves us over 1 million bits of plastic a year just by doing that. Things like the breakfast cereals were served in individual portion boxes. We got away from them and started serving. We buy it in bulk and dishing it up into bowls as it was needed. We looked at the menus and started substituting some of the meat for plant-based proteins. So we were like splitting the protein within dishes, one, reducing costs, and then obviously reducing carbon emissions that way. But it really is an ongoing project, which leads me on to the next bit, because obviously it is relentless. We're currently doing a project now to revamp the whole way we serve the patient's food at HHFT. So we've got a new menu project now that we trialled on 3 wards at Basingstoke, and it really was a success. We found that we thought that our menus were a little bit old-fashioned, the way we were serving like the meat and 2 veg model. So we came up with about 19 dishes that will stay in place all the time, with a focus on more plant-based options, less red meat, and getting away from the additional potatoes and vegetables. So the protein, carbohydrate, and micronutrients are all going to be contained in one plate. The feedback from the patients was extremely positive. The feedback from the staff on the wards was exceptional. And then we managed to visually, the waste was reduced over 50%. The only problem, we still had little bits of untouched meals coming back, where wards were ordering meals and then patients were going home or moving wards. So that's something we're going to work really hard on. Can I have the next slide, please? Okay, so we also signed up for a Cool Food program, which is going to help, which is an international organisation, which is as we're recording this data, we're going to give them the data about how much meat we're buying, where we're getting it from, and they're going to help us reduce our carbon emissions even further. Our next bit of something that we're working hard on is to reduce the amount of plastics and disposables that we use in our restaurants, and the paper cups and takeaway boxes. And that's been a project that's been ongoing for quite a while now, and that's about sort of changing the culture of the staff to be able to use reusable containers. We work closely with a company called Collie Box, okay, with reusable containers for lunch. That is now for lunch and supper. That has now moved on to Collie cups, so staff can purchase a hot drink, get 30% off the hot drink, and return the cup, similar to what you do at a football stadium with a reusable mug. So that 30 pence is coming off the price of each hot drink you take. So I have some figures here to come back to our food waste project. We estimated that we have saved on food costs £157,000. We saved 143,716 kilograms of CO2, so equivalent of 424,442 miles in an average car. Like I said, 1 million pieces of plastic just for those orange juice cartons being taken off the menu. We've reduced our production waste, our ward, the stuff that's been coming back to the wards, by 24%, and increased the main and dessert consumption with the patients by 20%. So we're on the right trajectory. We're not quite there yet. When we get our new menu up and rolling, and in Basingstoke we are targeting the 1st of July, our target is 0 patient waste on the plated food. So I'll be interested, hopefully maybe next year I can come back and tell you how that's gone. Okay, I'll look forward to some questions at the end of the presentation. Thank you, everybody.
Thank you, Rob. I never tire of hearing about all the things you've got going on in
Gillian, I just
catering.
need to go back. Sorry, I missed the last slide. Sorry, just go back one slide.
Sure.
Okay, this is the good bit. So with the money that the department won from the Green Team competition, we purchased these 2 oil filtering devices, which again, and that keeps it going. So this is going to reduce the amount of cooking oil we use by 1/3, and therefore, because we're not having it delivered, less carbon emissions and less waste. So with that £2,000 we got from our Green Team efforts, that's how we reinvested the money back in the department. Although I did think it was like £2,000 for me to spend, but I was told no, it had to be invested in the departments. That's what we did. Okay, thanks, everybody.
You're done. Definitely done, Rob. Brilliant. Thank you so much. It's great to hear about all the different projects going on. And I will give a shout out to Miranda, who worked so hard with the catering team to implement all of these amazing projects. So yeah, great. I'd love to hear what happens this time next year. So I think it's safe to say the Green Team project, or the competition, has just been a really worthy project. It's brought fantastic results from clinical and non-clinical teams, which is really important for us. And I think it just proves that we can all contribute, and it can be small, things. If you're thinking about your own practices at home, things like switching to LED lamps, which I think most people just do these days anyway. A really easy one, being really mindful of your own food waste at home. Traveling responsibly, swap out some of those journeys that you do in your car, especially the small ones and the short ones. Add more active and sustainable travel into your kind of daily life. And things like, using refillable items as well. Let's cut down on the single-use plastics. Things like coffee cups, it drives me mad, but, just keep your cup. There's cups everywhere. Keep a cup with you. And I think really one of the key things is just to keep informed and be aware. And that's the kind of last message from me, and encourage others to do that too. We've got lots of information on our website, and the internet's full of great suggestions, and there are always local green groups, and they're always looking for new recruits. So I'd really encourage you to become more involved if you have the time to do that, and take those small actions. So a big thank you from me, and I think I'm now handing back to Alex.
Yeah, thank you, Gillian. Honestly, you always make me feel so energized, and I have my reusable water bottle here, don't worry. So thank you. That's been brilliant hearing from the teams. Right, there's lots of lovely comments in the teams, and I think people really inspired by everything we've heard. If you've got any questions for the teams, do put them in the chat or the Q&A, and we'll come back to them after our last kind of presentation element, which is from Natasha and Luke. And this is looking to the future. So Natasha is our program director for our new hospital program. For anyone that doesn't know the acronym, MOSE is Modernising Our Hospitals and Health Services, and it's all about how we are using the 900 million from the government over the next 8 to 10 years to really transform not only the buildings but the way we care for our population. And Luke is our energy manager, and so I'm going to hand over to you, Natasha and Luke.
Thanks ever so much, Alex, and lovely to see you all this evening. I'm also going to start with a short video from our national new hospital programme team. Aware some of you might have seen it before, but it's quite impactful. So if we could just play that one, Gemma, that would be great.
Over the last 75 years, medical advancements at the NHS have outpaced the institutional buildings that have housed them. The new hospital program is looking at innovating its building delivery to adapt to technology in medicine to bring a sense of pride on how we deliver healthcare safely for our patients, staff and visitors without compromising on quality or experience. This means we need to design a facility for extraordinary measures, including future pandemics, facing the challenges of tomorrow. As we reimagine the hospital, we must first define what is a hospital, what are the essential pieces to deliver healthcare, create a universal chassis of our building module that adapts to future medical advancements from robotics, drones and logistics, so that our caregivers can focus on delivering world-class care to our patients. Let's start with the patient room. Looking at a modular head wall unit, it will be a self-contained environmental control system. empowering patients to have agency over their environment, yet still have the integrated medical gas, electrical outlets, and digital information for staff to seamlessly access. The same goes for the footwall. As a modular system, it is designed to accommodate technology for today and tomorrow via a flexible screen that is customizable to fit the individuality of our patients, yet with a touch of a button, it can also accommodate visitors and loved ones. The same goes for the hygiene zone that visually encourages universal hand washing for a safer environment. All this fits in a simple structural grid to help create a cellular structure that are repeated several times to create the chassis. This universal module adapts to function. It will accommodate an inpatient unit, prep and recovery bays, operating theatres, outpatient and accident and emergency departments. This module essentially becomes the new structure that scales up or down depending on the need of the town and cities across Britain. Yet it is all organized around a communications module that essentially ensures that parts are intuitive and segregated for the public, patients and staff, and robotics. The facade will be designed to be flexible, responding sustainably to the environment. It will contain and house pods when needed. Such pods, amongst other things, will be inpatient bathrooms. It will be prefabricated off-site in a safe and controlled environment. Not only will we drive quality of construction and pride in British manufacturing, it will be a flexible system that can allow a multitude of external design configurations to fit the unique landscape of Britain's cities. With this modular design, we can decide how the building is efficiently built without compromising aesthetics. Relying on our workforce, we can bring those pods to site and plug them in where needed. With the well-being of our staff and patient experience in mind, the hospital of the future can be realized today.
Thank you, Gemma. So I'll touch on a couple of bits in a moment, but just to give you a bit of an overview of where we are with the local programme. So we have completed our formal aspect around consultation that completed towards the end of March. We're now in a period of reviewing that consultation feedback. We'll be coming back later on in the year with something that's known as a decision-making business case that really does consider all the feedback we've received with the proposals that were in that consultation. I'll just do a plug for the Hampshire Together website. All the documents, if you do want to find out any more of where we're at, are all on that website. So Hampshire Together, and perhaps we can circulate that afterwards. But the local programme remains on course to deliver the new hospital and the other investment that comes alongside it by the early part of the next decade. And one of the exciting things that's going to be happening over the next month or so is that the national team are due to be releasing further details around their design spectrum of documents called Hospital 2.0. So yes, this is the design of the infrastructure, but it also is design details around things such as digital, workforce, etc. So if we go to the next slide, please. So obviously the video that you've just seen paints a very exciting picture of what the future holds. But for us locally, we want to embrace that vision of the national team and to ensure that particularly our new infrastructure, whichever site it be on, is part of a future that realises a hospital which is net zero carbon. And if it does that, it will be one of the first hospitals across the country to realise that vision. We are working quite closely with lots of partners locally, as well as our new hospital programme team, on all of the facets that you see on
Natasha, have you muted yourself?
Hello, can you hear me?
Hello. Yeah, we can hear you again. Yes.
So sorry. Yeah, so we're working with partners locally to make sure that we maximise all of the facets that you see on this slide here. and recognise that the hospital investment will ensure that we're an anchor institution in our local populations, and that benefit, environmental, social and economic, is felt across our local population. But what we wanted to focus on, possibly from some of the work that we're doing at the moment, is some of the work that really has a practical feel as to how we're going to achieve some of those ambitions. And I'd like to hand over to Luke now to give you a bit of an insight into the work that we're trying to do to understand our future energy needs and how we might sort of look to a carbon neutral future if we get that right. So Luke, over to you.
Thanks, Natasha. Good evening, everyone. Yeah, I'm in a very fortunate position in the Trust where not only am I looking forward with the Trust and the NHS for net zero, but also looking back at previous installations and existing hospitals and how we can preserve, our listed buildings of Winchester, but also make sure they're running in the most efficient way, using the least amount of energy and polluting as little as possible. And with this is something we're working very heavily on at the moment, which is a heat decarbonisation plan. I'll keep it short and brief, but the heat decarbonisation plan outlines how business is planning to reduce their reliance on fossil-fuelled heating systems through the installation of low-carbon alternatives such as air and ground source heat pumps. And HDP is intended to assist organisations work towards their net zero carbon targets. And the reason for this, really, heating, as stated, accounts for nearly half of all energy consumption and 40% of energy-related carbon emissions. So the way that we're going to go about this is by highlighting assets, that's such things as air conditioning units, boilers, also the struggles that we have with steam for sterilisation, and how we can replace them for newer, more efficient technologies, not only to reduce energy usage and carbon output, but reduce downtime, allowing for a more efficient service. So once again, everything that myself and my team are doing is to ensure that, as Alex mentioned previously, is having that efficient service, making sure people have the ability to complete their work and look after the patients as best as possible. I'm very grateful that not only do I get to look at, as I mentioned earlier, the older buildings and try and see the challenges of replacing single glazed windows for internal or secondary glazing, but I get to look at how we can look at geothermal drilling in terms of digging down to get standing water that's hot enough to provide us heating, but also to look at solar panels to provide us non-stop year-round energy. It's an extremely exciting time, and I just want to say I'm very grateful to be in this position and look forward to delivering this through the years to come. And I think that's it for me. So thank you. I'll pass it back to Gemma and the team.
Thank you so much, Luke. Natasha, did you want to say anything at the end, or are we ready for questions?
Ready for questions, I think, Alex. Thank you.
Okay, brilliant. Thank you. So that is the end of all the presentations that we are sharing with you this evening. So we could probably take down the slide deck and kind of open to questions on anything you've heard. Just while we do that, we had a question that came in, which I think relates more generally around urgent treatment centres. And the urgent treatment centre, and I think it references the something at Hook. So I think what the facility that's opening at Hook is around the NHUC, North Hants Urgent Care, providing same day urgent care out of Hook. So UTC urgent treatment centres, currently we do not have any of those in the North and Mid Hampshire geography. We are currently looking at a proposal to, and we've put in a bid to get money to put a UTC on the Basingstoke Hospital site next to the emergency department, but in order that the patients who get themselves to hospital can get treated more quickly, and get some capital money to do that. We've also asked for one at Winchester. We're not sure we're going to get both or either at the moment, but that is an opportunity. You will also heard about urgent treatment centres in the context of our new hospital, because the plan is for an urgent treatment centre at Winchester. That was the proposal we put out to the public. And as Natasha said, we are reflecting on all of the comments that we received back as part of that. So So I think the comment here, I don't know if that answers the question from David, but I absolutely understand that if the only place you could go was Hook, if you live in Hook, that's brilliant. But obviously, if you live in other places, then the public transport links aren't maybe good enough to make that your only option. So that was that question. Right, we've got a few other questions that have come through. So there was one about the surgical video. How do the Trust empower staff to challenge the status quo and look at improving and reducing waste? I'm going to be really mean here because I've got various executive colleagues and you're probably all fed up with my voice. Tim, as our Chief People Officer, I can see you on our screen. What do you think we do and what more could we do to empower staff to challenge the status quo?
Thanks, Alex. Yeah, good evening, everybody. Yeah, it's a really good question. I think there's a number of things that we can look at. You know, there are formal ways in which our staff can kind of speak up and respond to areas where they think they can make improvements. And ideally, you'd like that to kind of be through the line manager and through the line of control. But sometimes we know that doesn't always work. And therefore, there are other avenues where we encourage people to speak up in confidence or to use a speak up guardian. But more and more, I think, what events like this do and what some of the kind and some of the examples that you saw today were just around creating a little bit of competitive spirit within the trust, creating a little bit of ambition and just getting people in a very fun way to kind of present their ideas and suggestions going forward, and for that to kind of be listened to and to get people like Alex and others championing this whole notion and idea. And I think the more that we create that environment, the more we create that climate, that gives people, I think, permission to stick their hands up and say, I can think of a way of doing this better in a more sustainable way, you know, in a way that helps and supports others. And I think some of the examples we've heard tonight have been so inspiring, and I've heard them a number of times and I still get inspired by them every time I hear them. There's something about how do we just create that as a norm so that we don't have to create special events for it, as important as they are, and that just becomes the way that we do things all of the time. And I think that's the challenge for people like myself and my executive colleagues about how we enable that to happen. So, you know, the short answer is lots of avenues for people to do it. I think the tougher answer is you know, how do we create that culture where everybody thinks, I've got a voice, I want to be heard in this space, and I've got permission to kind of make change happen.
Yeah, brilliant. Thank you, Tim. And can I ask our green team people, so Rob and Laura and colleagues, what gave you the sense that, yeah, I can do this? I've got an idea and I'm going to make that happen. Was there anything that really helped? Rob, you've come off mute, so there you go first, and then I'll come to our theatre colleagues.
Just as a caterer, it's just about getting back to basics. It's about chefs, about loving the food, and we all know that you know, all the energy and water consumption and the production of the food, just to waste it just isn't right. I mean, if we just get away from just the financial aspect, it's become much more on the news now about how important food is and food security. And one thing, it just used to get me, just to grate with me, because I came from a secondary school teacher, and we used to teach them about sustainability there and environment, and particularly about dairy farming and how it's like a little bit sort of frowned upon now, and the amount of water and energy. Yet we were making loads of custard just to, in theory, throw it away. So that's what sort of inspired me to say, no, let's just get back to basics. Let's look at the food that we're getting, and we should be loving the food, and we should be the champion for the whole hospital without doing it as a project. It should just happen sort of naturally, and it isn't it. And when you pick up the awards and when you get sort of pat on the back and people can see it in data form and graphs, it is inspiring. And we'll go back to the drawing board now, and this time I'll ask some of the teams to come up with projects to do for next year. So we shall see.
Brilliant. Thank you, Rob. And what about Laura and Krithia? Have you got any thoughts about what made it possible for you to do this?
Yeah, I mean, I think for us, it's been an interest of ours anyway. And I mean, Gillian and Miranda are amazing, just really enthusiastic, really supportive, always on hand to sort of push a project forward. So for us, when sort of the opportunity came up for the Green Team competition, it was, I guess, an opportunity for us to try and embed that culture in our department, and just try and sort of promote sustainable value would you say?
Yeah, I think it's empowering other people in our department to try and do this as well. Like as Gillian and Miranda have done for us, we hope that we can do it for other people in our department as well, just through communicating and letting them feel like their voice is heard as well.
Yeah, brilliant. Thank you. That's great. Okay, so that's helpful. Let us go on to, oh, I've switched between chat and Q&A and now I've just got a wearing circle. Right, another question that Tom's posted around, is there consideration for how the new hospitals will be adaptable as local population grows and new technology becomes available? Thinking of the us of the next generation or two, working with an estate that's decades old. Yeah, we're going to build something lovely and shiny, and then our children's children will sit there and go, who built this old rubbish? You know, so no, Natasha, how do we sort of future-proof? What's going into that?
So we are indeed considering future proofing on a number of different levels. One is that we're working with national colleagues around understanding our demand and capacity for services, and that starts to look not just in the here and now, but it projects out a number of decades beyond where we are today. In addition, we're also not doing intensive construction on the site or the sites that we're looking to do the new build on, therefore leaving space for future kind of healthcare needs and requirements to allow for changes, probably in a similar way that we've done with our existing sites since the 60s and 70s so far. And also our national colleagues are researching and looking at international best practice around how you build in a level of flexibility within the buildings themselves to allow for adaptation of technologies. So we're not doing this alone. That's one of the benefits of being part of the national programme. They are taking the best internationally that's known about services and so forth as they stand today. And some other healthcare systems, of course, are further ahead on things such as robotics and also things such as AI and stuff like that. So I think we're trying to take a number of steps at the moment to make sure that we future-proof as far as is possible with the investments that we're due to make.
Yeah,
thank you, Alex.
Thanks, Natasha. That's great. Okay, coming back to what makes it possible to make change and quality improvement, and Bex has put in there access to the QI Silver training and supportive senior management, so that's great. Now, Nicola is our chief pharmacist, and she offered, because pharmacy aren't here to speak. I'm now letting Jan and Gemma know you may need to unmute her microphone, because I think as a non-nominated speaker, she may struggle to speak. But Nicola, you are a senior manager in pharmacy, and your pharmacy team did an amazing project. How did you manage to kind of support them to do that? Because I'm sure they've got lots of very important, busy jobs that you would want them spending their time on.
I have, but for them, it was the duplication of work and seeing things where you're wasting time because you know that medication went up to a patient. They've moved wards, that patient hasn't received it, they stay in hospital for longer. So actually, just by sorting out the system at one section, it made a huge difference to the patient pathway and something that we were really keen to practice on. We also, the Trust invested in 2 new SATOs for us, the senior assistant officers, who were able to do that work rather than taking it away from a pharmacy technician who might be checking the items. So that investment in 2 members of staff paid for those members of staff within 3 months of them doing the project, which was really incredible. That's for the year. So we were really pleased to have that investment and that support. But we came up with an idea, and then you pitch it and hope for the best. But you're given the permission to try it and see what happens. And I think in other trusts, I know that people have struggled to do that, to get the investment from senior teams and colleagues just to have a go at a project and know that it might fail, but it might not. And I saw all of the Green Team presentations, and I don't think any of them would be classing as not achieving. So I think it's been really great to have that opportunity for people who are doing the job to see what needs to change and to allow them to lead on it as well. That's really key.
Okay, lovely. Thank you, Nicola. Okay, and Jane Davis is also saying the QI team have been really supportive in terms of improvement as well. So that's fantastic. Thank you. Right, Paul has got a question here about whether the Trust is working with our town councils to create safe cycling and walking routes to our hospitals. And I wonder who's able to answer. Oh, I can see Shirley nodding, or Gillian might have a view. Who wants to come in and answer that?
I'm happy for Gillian to come in. It's definitely one of the key things that we're looking at. Gillian, do you want to come in?
Yeah, so we've invested in a sustainable travel lead in our organisation, and he unfortunately couldn't be here tonight, and I'm sure he would have lots to say on this. So we really, I think it's about building up relationships with key people in our local authorities and our county councils. So our new person, Andy Wincup, is very experienced. He's a cyclist himself. So we brought expertise into the organisation to help us engage, inspire. He knows the right things to say. So I think that as a first off, having our new sustainable travel officer is very key for us. Those building of relationships, getting feedback from staff, from patients, all of those things really make an impact. I think Natasha might add to this too from a more strategic level.
Yeah, I think that's it, isn't it, though, Gillian, that we're doing both the sort of on the ground roots stuff with staff and patients and starting to sort of see that come through. But we're also investing time and energy in digital infrastructure that aids those discussions at that level. And we've also got strategic partnerships moving forward with Hampshire County Council, who's the statutory sort of provider of some of these services, to see how we can influence kind of the infrastructure that is in our communities, as well as our local planning authorities, particularly focused in conversation with Winchester City Council and Basingstoke and Dean Borough Council. So I think what's really starting to come through team resources now is working locally within our organisations, as well as trying to make that plan for the future and make sure that our local infrastructure reflects that.
Yeah, thank you. And Gillian, while you were talking, Avida put in the chat about the bike scheme. What's happening? There's been a couple of bike schemes, I think, hasn't there? Electric bike scheme, and then also the bike purchase scheme. But yeah, talk about bike schemes.
Yeah, sure. So we've got always had the bike scheme. We've actually got two, but we've got one that's preferred and is a better option for staff. All of the information for the bike scheme is on our staff intranet on the sustainability pages, and it sets out exactly what you need to do to access that. And we've also, with Andy now on board, we're going to revive our electric bikes. So we've got 6 electric bikes in the trust, and that allows us staff to try before you buy. Basically, they can take them for a month. They can see how that works for them in terms of getting to and from work, and then they can use the bike scheme to purchase if that's the way they want to go. So we've got all these schemes running. The electric bike scheme is the staff one is not quite ready yet, but it will be very, very soon.
Excellent, thank you. Great question, Avida. Okay, so I think we have covered most of the things in the chat and questions and accolades. So I will just allow any of our speakers or anybody else if there is anything else anyone wanted to raise. But if not, it only remains for me to say a massive thank you. Oh, Jane has put up her hand. Now I don't know if they'll be able to unmute you, Jane, so you can come in, hopefully. Come in. Oh no, it's not unmuted. Let's have a look.
I'm now unmuted.
Excellent.
So, is the new hospital going to be at Dummer still?
So the consultation had 2 options. One was the Dummer Junction 7 and one was the current Basingstoke Hospital site. And the stage we're at the moment is all the information is being reviewed and tested. And actually during consultation, other people suggested other sites, that some of which we'd already looked at, some of which we hadn't. So all that work is happening. The decision as to where it will be built is likely to be made in the summer. So that's the timescales. We're sort of being slightly vague and saying summer, but within the next few months there will be an actual decision rather than just options. Yeah.
Thank you for that. Thank you.
Okay. Pleasure. And with therapy dog as well, does it say? Yes. Lovely. Thank you. Paul, do you want to come in? Oh, sorry, again, the team will have to unmute. Oh, you're on mute still.
Oh, no. Good evening,
Yes.
all. Thank you, for the invitation to consultation. And so that I arrived late actually because I was on the road trying to get home. So thank you very much for the consultation and involving the public. And it's good that the basis of new hospital is getting going, shall we say? Because it's been many years in the offering, isn't it, Alex? Been many years, and it's nice to see you again. It has, and you said it said it's going to be 8 to 10 years. So when is it 8 to 10 years? Is that 2020, 2033, or 2035? Because this seems to be this is a bit like the many down, isn't it? It's going on year after year after year after year. So I just wondered when it's actually going to take place, because
when the grand opening will be. Well, we're currently so the National Hospital Programme has a schedule. They're scheduling all the hospitals across the country, and we're currently for opening between 2030 and 2035. So we have a working plan that opens in about 2032, but there's lots of things we need to work on between now and then. So that's still 8 years away. But actually, in terms of the making the decision on the site this summer, and then going into proper business cases to Treasury, design, construction, all the rest of it. Actually, I think 8 years is going to fly by fairly quickly. So yeah, that's the plan. Between 2030 and 2035 is when we will get the majority of our funding. So we're aiming on an opening around 2032. But I don't know whether Shirlene or Natasha want to comment on that at all. Shirlene, come on in.
I think, Paul, just to say that between what Alex has just said, in parallel to standing out the business cases, we will be working and engaging people on, some of the service change that you had seen in the public consultation in parallel, because it's an iterative process as we put together the business cases, and the design comes from the national team about what their expectations are. So we will have to look at some of the national expectations, the local nuances that we need to make sure are incorporated as part of the design. And that iterative process is actually, as Alex says, will be happening between now and the opening. And there will be also clearly some of the infrastructure that needs to be in place, before you have the beautiful building as well. So all that will be taking place. So you will see it being developed in phases and stages over that period of time. So it won't be inactivity at all. In fact, it will be a series of ramped up activities once we have the decision making.
No, thank you very much. And as you may know, Alex, I work for Frimley Health NHS Trust, which is going through a very similar process as yourselves. I've got a new hospital there by 2030 or thereabouts. So it's a lot going on there. And in terms of health and inequalities and the consultation with the public, is there more of a drive to involve members of diverse communities in terms of hospital consultation? I know you've been pushing really hard on this, Alex, and it's good to hear about sustainability, like what Robert delivered on the food. I thought it was excellent, and the other initiatives as well. So in terms of involving diverse communities, what extra is taking place now than before to involve people, to get the best talents from across our communities?
Shirlene?
Do you want me to come in on that again? So Paul, this is definitely an area, and as part of our integrator impact assessment, you'll see that we looked at the impact on a diverse community, the people with protected characteristics, people who are harder to reach. We engaged with community groups, focus groups. We were quite deliberate in targeting that wider range of people so that we could hear from them. And that will continue. So we did an initial analysis as part of the integrator impact assessment. We went to them during public consultation to get feedback from them. We went to colleges and so on to also listen to younger people. We went to Maternity Voices Partnership to hear from mothers. We went to listen to people with disabilities, neurodiversity, homeless, etc. So we are making sure that we're reaching out. As part of our journey, we will continue to do that. And as we look at some of the developments and the design of our facilities, there is also quite a lot of engagement that the national team have done with the diverse groups, but we will make sure we do that locally as well.
Yeah. Right, Shirley, I'm gonna we are running out of time. Sorry, Paul. Is there one last little question, because we're aiming to finish at past, but go ahead.
No, that is, I'm going to ask about the leadership, about the diversity in the leadership at the hospital. Is that more diverse now than before? I know you've been pushing.
And we've really been pushing. Yeah. So yes, we are making some progress. So I think about 3-4 years ago, one of the things we look at is the number of people, for example, from Black and minority ethnic groups that are band 7 and above. So that's sort of middle management and above.
Yes.
We've got that up from around about 10% 3 or 4 years ago to over 13% now. However, our colleagues, our workforce is 25-28% Black and minority ethnic, so we are still by no means representative of our workforce as a whole. And so this is something, Tim, who you heard from earlier, uses the word restless. I am very restless about this situation, and it's good we've managed to increase it from 10% to 13%, but we need to get it way up, and we need to accelerate the pace at which it's increasing as well. So yeah, we're doing a lot of work on that around reverse mentoring, around leadership development programs, around all sorts of things, but we are not yet representative of our workforce, of our colleagues, and we're working really hard to address that.
Okay, thank you. No, thank you, Alan. Thanks for being so comprehensive. Thank you.
Yeah, thank you. Okay, so Nicola's put a brilliant thing in the chat about more publicity for these schemes. So that's a task for our comms colleagues to get Rob and Laura and colleagues on the front pages of the papers and in the on the television and everything, talking about these amazing projects. That's great. So we are out of time. I want to thank everybody very much for coming along, especially our speakers who have done such a great job. We are always interested to know what you'd like us to tell you about at these events. So as I say, today we took our 5th strategic theme about innovating for a sustainable future. It sounds like there might be some interest about making it a great place to work for all our colleagues, and particularly colleagues from diverse backgrounds and different needs. So maybe that might be a good theme for a future session. But if you have ideas and things you'd like us to talk about, please do contact the communications team. You should have details from having come along to this, or look on our website. And if you have any other feedback about, was this a good time? We ran it a little bit earlier in the evening to give you a bit of your evening back. Does that work for people or not? Let us know, because we want these to be useful for all of you. So thank you so much. Really appreciate you giving up some time to hear from the hospital and colleagues, and just thank all of our staff and our patients and population for the support we get for the hospital services. We really do appreciate it. Thank you so much. Good night.
Thank you.
Good night. Thank you.